Good afternoon and welcome to today's webinar, Regional Care Cooperatives, Planning Ahead for Further Rollout. I'm Luke Bevere, a Senior Consultant at Mutual Ventures, and today I'm joined by Wendy Williams, the Lead Commissioning Consultant for Home and Future, the South East RCC, and Stephen Sinclair, Senior Commissioning Manager at the Greater Manchester RCC. I'm also joined by Mutual Ventures colleagues Kat Moore and Liz Rowe. Throughout this webinar, we will be hearing from all four of Wendy, Stephen, Kat and Liz on the work of the South East and Greater Manchester RCCs. We'll be looking at the current policy landscape for RCCs and thoughts on what other regions can be doing now to lay the groundwork for a further wave of RCCs across the country. There'll be plenty of time for questions to our panellists, so do please use the question and answer function throughout the webinar and we will get to these later on. So, bit of an overview, which should probably feel familiar to lots of people on the call already, but what is a regional care cooperative? We're very aware that regional approaches to commissioning in children's social care and regional ways of working aren't something new. There have been lots of good examples over many years of local authorities coming together to manage regional frameworks, share data, run forums with providers, share risk in commissioning services, and develop guidance and tools sharing best practice. The RCC pathfinders build upon this and provide a mechanism to go further with regional working. Ahead of the RCC Pathfinder programme, the Department for Education outlined their key criteria for the aims of RCCs, which are on the screen now. So the Department for Education set out that RCCs aim to enhance regional commissioning and improve the delivery of care services for children through increased local authority, negotiating buying power, and improved ability to shape the market for care placements. Crucial to this will be the role of the RCC in developing improved regional understanding of supply and demand for children's care placements. And the intended outcomes look at an increase in the right types of placement for looked after children, placing them closer to home in a setting that better meets their needs, and ultimately aiming to improve outcomes for each child. As well as this, they're also looking to improve regional collaboration and a market that better reflects the needs of children. And all alongside this, they should deliver value for money for the local authority and prevent spiralling costs felt throughout the system. Now, in 2024, the South East and Greater Manchester were selected as pathfinders to design and set up two regional care cooperatives, the first in the country. And the Department for Education set out the 6 minimum requirements for the two pathfinders, which are on the screen now. And the first of these was to carry out regional data analysis and forecasting future needs in partnership with health and justice partners. Secondly, to develop and publish a regional sufficiency strategy. Third, increase and retain more foster carers. Fourth, create leadership and governance arrangements for the RCC to make swift decisions and invest sums of money over the long term. Fifth, market shaping, so working as one customer with providers to address local needs, improve value for money, and commission the care places required from external providers. And sixth, to develop new regional provision with partners. Mutual Ventures were appointed as the delivery partner for the Regional Care Cooperative Programme and to deliver a programme of national support by the Department for Education. The Mutual Ventures team supported the two Pathfinder regions to develop their RCCs, and a lot more of this information can be seen on the Mutual Ventures website, which we'll highlight to you later on in the webinar. But the big question for everyone here today is, what is the current landscape for RCCs and what does that look like? So the Children's Minister has confirmed that RCCs are the future of commissioning children placements in England and they will be rolled out across the country. In November, at the end of last year, the Children's Minister Josh McAllister told the National Children's and Adult Services Conference that the government would speed up the rollout of RCCs and saw them as the future basis for creating homes for children in care. It was also suggested that the government would be setting out plans for how the system will move towards regional care cooperatives across the country. Details have not yet been published explaining whether the expectations and responsibilities for RCCs will change from the original requirements that were shared with pathfinders, We are expecting to hear more about this at some point soon. And we're also aware that many regions in England have a history of regional arrangements for commissioning children's social care placements, and they are exploring how to go further with this now. We know that lots of regions have been planning for their own regional commissioning arrangements, and they are actively exploring what having a regional care cooperative could mean for them. With more information expected soon on the future of RCCs, now is the time for regions to ramp up their planning for the future. We are hoping that the conversation help regions at varying stages of this journey to think further about what an RCC could achieve and what more needs to be done now to help plan for this in their region. So I'll be handing over to Wendy and Stephen. We've got several questions that I will be asking first, and then we will be moving on to Kat and Liz for question and answer as well later on. Welcome, Wendy and Stephen. It's so good to have you both with us today, and thank you for taking the time to share with us. So the first question that I wanted to ask the two of you is, what is the specific change that your RCCs are aiming to affect in your respective regions? I'm not sure who, Stephen, do you want to answer this one first?
Yeah, no worries. Yeah, thanks, Luke. Hi, everybody. So as Luke said, Stephen Sinclair, working as part of the Greater Manchester Regional Care Cooperative. I think really probably for us, probably similar to a lot of you, I'm guessing on the call, and hopefully it sort of resonates. Like we all want, we certainly from a Greater Manchester perspective, we really desperately want a system that provides like the best possible home for our children at the time when they need it. And that might be about keeping children as close to home as possible, reducing the distance that sort of they're having to go and live and the disruption that a lot of time is caused. So very much that ethos of sort of the right home, the right place at the right time, really. And the reality is, for a whole range of different reasons, and much to probably all of our frustration, we're not really able to do that as often as we want to, or as effectively really as we'd like to. So we really, us and Wendy, and I'm sure all of you want to really kind of grasp that challenge really, and be seen and be trying to do as much as possible as we can to enact change really in a number of different ways. So that's been sort of a catalyst for us, I think, from a Greater Manchester perspective. That's been as I said, the driver behind what we see as some of our priority areas to address some of those challenges, and a number of sort of themes of work that have sort of come out for us as part of our delivery, if you like, and the work that we're trying to do as a regional care cooperative. So we definitely think that there's massive opportunities for us, absolutely, to kind of work as a group of 10 local authorities for a range of different reasons, and I'm sure we'll probably get the opportunity to come on to some of that in a bit. But definitely sort of strengthening the governance probably around how we kind of work together, so that we're able to, and we're afforded the opportunity to make decisions, really kind of regional decisions, as quickly as possible, and in the best interest, obviously, of the children who were sort of caring for. Definitely see a role for us, and have seen a role for us in investing in kind of really high quality provision regionally, and working with some of our partners, a range of different amazing partners actually in the region, who can help us to do that. And some of that really, in terms of working as a region, will mean, we think, being able to kind of ensure that we've got sort of really high, great quality homes for our children, but rightly we need to have an eye on how much we're spending, and that kind of value for money point is something that we can't, shy away from, because we know it's a chronic challenge really for a lot of individual local authorities, and there's sometimes is really, well, quite often is causing a lot of system strain and pressure. So actually, how we can seek to address that really through sort of a regional approach. A big thing for us rightly, and it's carrying a lot of coverages around the profile of our sort of sufficiency landscape, really, and where our children need to live, and want to live, whether that be with foster families, whether that at the right time in residential homes, supported accommodation, etc. And we, at times, it'd be fair to say we probably haven't got the right balance, probably like a lot of areas. And addressing some of that is really important to us. So a big thing for us is around kind of foster carers, retention, growth, ensuring that they're supported as effectively as possible to kind of help support our children and meet some of those needs. So again, back to the ethos of the right home, really, for some of the right children. And a lot of the work that we sort of do, and we're guided by, really, from our perspective, is very much based on the kind of needs and the understanding of need of our children and young people, and sort of that evidence base, really, to tell us actually what's the challenges that we're trying to solve, and where and how can we best go about doing that, both as a region collectively, but also recognising some of the sort of local differences and challenges that occur, because like every local authority in every region, there are differences, and we're really kind of cognizant of that and wanting to make sure that what we do is kind of reflective of that and supporting it in the best possible way. There's like loads of things that we could probably get into in terms of some of the individual work programs and like different strands of work that sit under some of those big things. But so happy to let sort of Wendy come in and give a bit of a view from her perspective, and then I can kind of come back in after that. It's not a problem.
Thanks, Stephen. Okay, so I think the two pilots are very different. So Manchester's quite succinct. It's 10 local authorities, one constabulary and one ICB. And then in the southeast, we've got 19 local authorities. We did have 7 ICBs and 5 constabularies. So you look at a really different landscape. And also in the southeast, hadn't been so much collaborative work done as what there has been done in Greater Manchester previous to the pilot. So starting on quite different levels. So that also says, all the people out there that maybe aren't doing such regional work at the moment, that's all great as well. And there's great opportunity to develop that through being a regional care cooperative. So you don't have to have things in place, but if you do have things in place, Manchester equally is a great example of building upon that. So I know there's fantastic work that's already going on out there with colleagues in different regions, and you can build upon it and shape it in a way that really benefits the work that you've already been doing. So the Southeast is slightly different, and we've come in to gather sort of 19 local authorities, and we've done some different things. So one of the things quite early on is that we were hosted by West Sussex, but the group of DCSs, so all our 18 DCSs were part of the pilot, sort of felt that it would be good for the RCC to have real flexibility and pace to change and meet need. So in the southeast, we're actually now set up as an independent not-for-profit company, and that is to as well give us some agility. So it's all different for different people, and it's a whole process for evaluation about what you might want to think you want to do. But for the southeast, we really felt that it was a great opportunity to be agile. It's a really big, not only geographical space, but also local authority space. And we wanted to get pace on that and to make sure that we could also respond to need for our children and young people, but also look at maybe some new opportunities around social investment and other things like that, which are slightly more difficult to do if you're sat within a hosted sort of local authority remit. So we looked at different things around that. What we're really keen on in the southeast is joining up our work, but the baseline of it is to know our children really well. So we have done work around evidence-based tools. We're also doing work to build regional frameworks across the board. So we're just moving into that process where Home and Future would bring on those regional frameworks. But also we've got a whole program to develop that. Now, there's a lot of noise in that in the system, and profit is in the system, but there is also something about that actually, if we know our children well, we really need to know what we want to buy for them, what's the right home for them. Home searching is really, really important. And I think sometimes it gets lost in procurement. So home searching is really, really important to get that right for our young people. So that's a real focus for us. We've got a big program that will be a needs-led commissioning model. So by sort of 2029, I know it's a bit off, we will have all the frameworks and that in place, but that will really drive them. We will know our children so well, both in-house provision as well will be within that. We've developed local in-house provision, and we've developed things like memorandums of agreement, so we can share in-house provision that's been brought through new capital monies through Home and Future. So those sorts of things are beginning to shape the market. We've also done a big piece of work around hosted children. So we're very close to London, parts of us, and that brings on a challenge. And actually, there's always a nuance, isn't there? People go, oh yeah, I host lots of children. But actually we did some work on it, and we got some actual data around that. So we do host about 2,000 children, but we also export about just under 2,000 children. So we want to do some analysis on those. So why do those children go out? Why do we bring these other children back in? And what do we need to do to maybe change that? So the focus is very much on really understanding our children. We've built a really good data platform that goes on the back of Manchester's as well. Data is key, data is king, data is God, all those sorts of things. Really, really important. We've also got a really big, as Manchester, workforce is critical. If we don't build, you can build the homes, but you can't open them if you haven't got the right workforce. So we know there's like these really connected threads that go all the way through. But I think they're some of our big key drivers at the moment. And I think I'll stop there, and then people can ask questions and bits as you go forward. Is that all right, Luke? Brilliant. Thank you.
Yeah, I think that's great. We can certainly several bits that the two of you have referred to that we can unpack a bit more later on. But for now, I'll kind of run on to our next question. And you touched on it at the start of your answer there, Wendy, but I wondered if the two of you could unpack the impact of the regional differences in Greater Manchester and South East a little bit more, and how that has helped shape the different approaches for the two RCCs.
Do you want me to just come in, I suppose, on that? But it's dead helpful, actually. I know you maybe a segue in, Wendy, about some of the differences, and you're absolutely right. And we've talked at length, haven't we, about it's not necessarily a right or wrong thing, is it? It's kind of like what's right for the areas that sort of people operate in. So I guess from a Greater Manchester perspective, there has been that sort of long history of working together, really, as 10 local authorities. And that's, goes back 30, 40 years, but potentially is what we're really describing that through things like the Association of Greater Manchester Authorities, which paved the way really for the creation of the combined authority in 2011. And that really was part of the path to devolution and a number of devolved powers that we actually got in areas of responsibility, locally elected mayor, etc., and a lot of services that Greater Manchester Combined Authority have taken responsibility for. I think that sort of history of sort of collaboration and working together has filtered down really through sort of the organisations as well. So by that we mean the 10 chief executives get together and have got together on a really regular basis. Treasurers, DCSs, ADs, fostering teams, commissioners, even things like most recently our responsible individuals for all of our internal children's residential homes come together as a network. So that's really kind of important for us, I think, really in a recognition of sort of the ecosystem that we sort of sit and kind of work within. And added to that, I think through the combined authority, there's a breadth of sort of infrastructure that sits in place really to sort of support us and the local authorities, which really kind of lent itself and meant that for us, from a Greater Manchester perspective, the sort of natural step for us was to look at a shared service model in terms of the RCC and the delivery. But it really, it seemed like a logical step for us. So That's the route that we went down, and see ourselves certainly continuing to go down. And as we can come on to and talk about now or another time as well. Again, everything everything has the relative. There's great things about that. There's some things that make things tricky, and that'll be the same thing, I think, no matter which route people or areas tend to go down. Certainly for us, some of the things that we've been able to benefit from, as well as sort of the established governance and forums and networks that we can make sure that the work's connected into and driven by. When I mentioned the sort of the infrastructure, those are things like legal team, legal services, really important, procurement team, IT, information governance, HR, PR and comms, data and analytics, investment team. All those things have played a really, really critical role for us in terms of both the inception of the RCC and the work that we've subsequently attempted to deliver with the 10 local authorities. So that really has been, our GM Sufficiency Board, chaired by one of our chief executives at Stockport, Michael Cullen. We have all of our DCSs represented on it. We have GMCA reps. We have partner representation and others, but it sits as part of the system, if you like, of established governance that we think's proven so far pretty effective for us in terms of from a delivery standpoint.
And Wendy for the southeast.
Wow, see, Stephen, you've just shown about all the assets and everything you've got from procurement and legal, and so we're on a different journey. Obviously, for the pilot, we were hosted, and that's great, and that's a great benefit to it. Being an independent company now is that we have to build that infrastructure around us, which is not impossible. And actually, parts of it are quite interesting and exciting. And you can come slightly outside of maybe what the council processes look like, because sometimes they can be a little bit slow. I'm just saying that. Don't hold me against it at all at any point. So we're on a different trajectory, I think. So there's a load of connection in Manchester. They've done lots of work prior to the RCC, both as being a combined authority. So when you talk about, chief execs meeting and things like that. So in this area, it's not quite as connected in that. But what the RCC has begun to do is build that connectedness. So as commissioners, we meet regularly. As data officers, we've been meeting and we meet regularly. So what, for me, it really does around the RCC is put an absolute golden lens on the home searching and sufficiency that we need for our children. Because as commissioners and directors of commissioning and positions that, we've all been in, you want to focus on this, but you've also got a massive portfolio of other things that happen in children's services. And what RCCs do is really take that golden lens and to have your full-time sort of focus really looking on, have we got the right homes in the right places, really improving home searching and having that everyday conversation about what do our children need, what do our commissioners need. We've got a workforce group that look around the workforce. And that's focused on all the time. It's not, sort of a regional group where we try to pull people in to look at it and to do a piece of work. It's a real focus and got some real drive behind it. We've just in the process of recruiting our participation officer, who will be full-time in Home and Future. They will embed young people's voices, and we'll have a shadow board in our company, and they'll be embedded in what we do. So I think there's lots of challenge to it, but actually there's some absolute real benefits to it. And no matter what way you choose to take your RCC or where your RCC is at the moment and where it could be. So, Manchester did like a 1-year plan. They're working from their pilot. They're now working forward from that. We did a 3-year plan. So we've got 2 more years running with the plan that we've got with our local authorities. But, we all know in a year, 2 years' time with LGR and all sorts of things will look slightly different. And we will look to work with that and how we grow with that and how we develop with that. So, RCCs are a real opportunity, I think, to put the golden lens on home finding for our children and young people, which possibly has been missing for a little while. So if there's anything else you want me to cover, Luke, I'll do that. But if not, I'll stop and then it will give others. Is that okay? Because
No, that's great,
Stephen and
Wendy.
I can talk for England. That's the worst bit about it. So
That's great, Wendy. Thank you. And this might be a chance, Stephen, to unpack a little bit more about the different services and programs that the two RCCs are running. But my next question to you is, are you beginning to see an impact from the RCC? And if you are, what's happening?
Yeah, good question, Luke. Actually, yeah. So there is. I mean, you do this sometimes, don't you? About sort of thinking, God, what difference have we made? Everyone's exceptionally busy trying to do a lot of things, and you've got to sort of challenge yourself and make sure that you keep in sight on the things that are really important, and you're able to sort of point towards some of the deliverables really as well. That's obviously hugely important. So I guess just to sort of reference almost some of the sort of programs of work that we're doing that we think are starting to show a difference and to gain traction really, I guess, across the sector and the system. So we've things that we've done that are really important to us that both Wendy and I have sort of alluded to before around that kind of regional footprint from an analysis perspective. We've launched our demand and forecasting data platform in the region, which is a real positive step for us. It's been a huge amount of work, so that's available to all of our Greater Manchester Local Authority colleagues now. We're using it really as the evidence base to inform and direct and to monitor the programs and the projects of works that we're doing, and to try and understand if they're making, if they are making a difference for us. It's also informing our market position statement that we're doing as a region sort of currently. We've recognised that we need to make sure we've got a focus, generally speaking, around kind of health and high needs of our children to make sure we can sort of improve their experiences and outcomes as much as possible for those children with the most complex needs, and dovetailing some of that with creating some of our addressing some of the supply challenges that we've got actually around the availability of homes to meet specific needs where we know there is a need. So we've got a couple of things in that sort of space that we're really sort of excited by and pleased about. We've successfully gone through a process to establish a really positive working relationship with two providers who are going to operate and deliver 10 residential children's homes for us within Greater Manchester. And we see that as being a real positive step for us actually in supporting particular cohorts of children. We're well underway around the delivery of those. We've acquired 4 of the 10 properties. The 5th one's soon to be acquired. We have refurbishment work that's underway. The first home we are hopeful that it will be open over the summertime, which we see as as a real positive move for us around us being able to sort of, as I say, identify where we need the right support and ensure that we've got the right resources in place. And wrapping around some of that is an established health offer, really, an integrated health offer that supports both those homes and our broader looked after children cohort. So within that context, we've been able to secure specific and ring-fenced funding that we see as a real opportunity and a commitment from our ICB colleagues to provide kind of dedicated clinical support and an engagement service around those homes, which will come online when the homes do. We've been recognising again, as Wendy has sort of said, that there's the representation in the market is some might say imbalanced. Really, we've seen the growth in certain sectors and in certain providers outweigh others, whether that be private providers or potentially VCF, SFE providers. So we've been doing a lot of work with our the local sector really to try and act as a bit of a catalyst for change around that. So we've got a social enterprise and community interest task force that's got some, huge representation from across the region, and we're working really closely with them actually to think about and work with them around what are some of the needs and the challenges, and how could their particular skills and expertise help support, and how can we help bridge that gap really, and enable them to come back into a space and a sector that for probably too long we've seen it them not been able to kind of grow into. Some of that, I think Wendy sort of touched on it earlier, links to what we can do from a social investment perspective as well. So there's quite a lot of work that we're doing there, and we see some really exciting opportunities actually to act as as a bit of a conduit between that, and play hopefully an important role in the space. The kind of fostering program and work is huge, is significant, as we all sort of recognise and can point to. The fostering development sort of program and the hub work that sits as part of the regional care cooperative now within the RCC, which we think's a great move for us actually, given it's hugely connected to what we want to do in terms of supporting our broader foster and growing our broader foster carer community and workforce, whether that be our foster carers who are employed by local authorities, but equally those foster carers who work with us through independent fostering agencies as well. So a lot of work that we're doing both from an internal fostering recruitment perspective, and we've seen some real green shoots actually around the success of that. There's a lot of work that we're now looking to do around within our local authorities around kind of expanding that fostering offer, thinking about how we can support recruitment, retention, some of the utilisation really as well, and sort of some of the provider collaboration. We've got a number of sort of spin-offs from some of that work as well. One of them is a room makers program, which we've seen as a real positive step for us, and something that's grown quite successfully over time really. Quite a simple idea really, but something that we've seen to have a real positive impact around the availability of space and capacity within foster carers' homes, and how you can potentially better utilise some of that to create more homes and more availability with existing foster carers. Not only have we seen that sort of take off across the local authorities, we're also having some really sort of positive conversations with providers as well, because for them it's a bit of a no-brainer really for us and for them, where we know that we've got foster carers who are willing and able, but the sort of the accommodation, the home that they live in, acts as a bit of a barrier to them being able to care for more of our children. So there's lots of sort of areas really that we're seeing certainly some in some ways some green shoots, but actually some more embedded sort of practice and support for us to deliver on some of the things that we need to do. Workforce is probably another one. Whether we talk about in the broadest sense our foster care workforce and the support that we can provide to them, but also actually we recognise that the market and the sector has grown quite exponentially, and workforce skills capacities in the right areas in some cases hasn't necessarily kept pace with that. And actually, what does it mean to work in the sector, and how can people in a residential setting, for example, what are the entry points for them? There's lots of work that we've been doing. I know Wendy's been the same in terms of workforce development actually, that's been quite exciting and interesting really, about kind of stepping to residential courses that we've set up and will be running soon in the region. Care to Lead programs, which are around kind of a progression pathway for aspiring managers. So really kind of working closely with the colleges and further education providers to make sure that we've got kind of a really effective offer to kind of help support where we see some of those workforce challenges, both now and obviously what we can kind of foresee into the future. that's probably like I'll kind of pause there, I guess, for
Yeah.
a little bit, Luke, as well, in relation to it,
Yeah,
like when you come in, and then I'll probably, no doubt, kind of come back in on a couple of things.
it's great to hear, Stephen. It's an awful lot going on, isn't it, in such a short space of time because it's only been launched less than a year ago. So it is great to hear. And we've had several questions as well about, particularly on the fostering point and how the RCCs are going to be more connected or potentially going to be more connected with the fostering hubs. And so it was really helpful to hear you kind of touch on that a little bit, Stephen, in your answer. But Wendy, if I can turn to you as well, of kind of what's beginning to happen and what's showing those green shoots.
Okay, so for us, we're a different ball game, but we have built one of our key things is we've built a really good sort of data platform. So we've worked with all our 19 local authorities to develop that, and that has given us some sort of more local data, so we've done our first regional sufficiency strategy. So it's given us some good data and that sits in that, so that we can actually look at the region in sort of sub-regions, because it is so big. So when you get to those sort of big regional areas, to have sub-regional data is just you just think, oh gosh, didn't know that. I mean, we've got some we've got Kent and that in our region. So obviously unaccompanied asylum seeking children, we've got a core bit in that area, but there was other bits around hosted children and things like that we could really drill down and look on data. So that's fantastic. That's the first phase for us. That will then be developed further now. One, it will begin to hold some cost data. So we're working with our local authorities to do that. So, that sort of cost analysis, what does it cost on a regional, sub-regional basis? That would be sort of, even if we got average costings on that would be a really game changer. So that's our next phase. It will also be an interactive tool. So this is the final bit of it. So all our local authorities then can just go in and get a bit more sort of real-time data, what's really going on in the region. They can drill down for themselves. So then for local authorities to write their local sufficiency strategy, be much easier. So that's a bit of a game changer. Everyone's really pleased around that. The other point that we'll also do, it will begin to forecast. So it'll be forecasting some trends, what it will look like if we continue on this trajectory, and also, monitor, if you keep these numbers of children in care, what does that look? We know one of our sub-regions takes more children in care at the moment than other, but that could be for all sorts of reasons. So how do we drill down on that, and how do we get the data? So our data platform is it's a bit of a golden nugget, and all the local authorities are so excited to get their hands on it. They're not quite there yet. When you can see something, not quite touch it. So that's what's happening in that bit at the moment. So that's really critical. We've also got a really good workforce bit, which Stephen's spoken about. So we've got Kevin Gordon in our team, who is our workforce lead, who I think is on the call. So if I get this wrong, I'll be told off later. But he's doing some amazing work and joining up with London and some other platforms to look at the level 3 and level 5 in residential care. We've also linked up with Kingston University, and I think Kevin's got 6 local authorities that have got places on that, and looking at that social pedagogy model. So we're really looking, how can we upskill our staff? How can we really make it attractive for them as well to come in and work in this area? And what does that look like? Then you overlap it with some of the needs-led work that we're doing. So we've been doing lots of work around evidence tools. So we've been doing work on like the Berry tool and also the CANS tool. So we've been looking at that, and we've been working with, I think, 10 local authorities now out of our 19 of a pilot. Now that the Berry bit is the only joint project. So also 3 local authorities in Manchester do part of the Berry programme. So Stephen and I work jointly on that with Roisin. It's really good, really interesting. But what we're finding out by doing some of these assessments on our young people, and very much we're working with local authorities about what they feel their need is at the moment, and predominantly across the board, that is residential. We've got lots of children in residential care. Residential costs are going really high. We've got a narrative that sort of says, oh, excuse me, we've got children in fostering that should be in residential, but we can't evidence that. So when you look at some of the work that we're doing on the needs-led stuff, I think we've done 74 sort of children in berries and cans, and just under half of those, about 30, score within a fostering range. So actually, they're in residential, but they could be in a family setting. So that brings to life some of the learning that we're doing. We're taking on the frameworks, the two South Central frameworks for the Southeast. So we want to build in home searching assessment tools. So we want to know our children really well at the beginning. And this is one of the first pieces of work that we're developing. And sucked Kevin in from workforce, because obviously we need to train the workforce of home searching and to train the workforce for the framework to understand what these needs-led tools mean, because we want to have really good constructive conversations with our commissioners, with our social workers, with our professionals, and also with our providers. And this is a really great way to do it and create that common language. So we're doing a test and learn in the Hampshire and the Isle of Wight. I have to remember all these things. Hampshire and the Isle of Wight ICB. They're doing a test and learn with us around using the CANS tool and also the Derby tool, which is a health tool, around children having really complex experiences. So can we work together? Can we look at these tools and these outcomes to actually get to understand what our children's needs are, but also as well to do some of that real sort of nitty gritty bit of actually who's going to pay what bit, instead of getting stuck in, that's not my bit, this is your bit. What the CANS and the berry tool do, so what the evidence tools do, that we put the child first and foremost, and we look at what their needs are and their strengths, and then we look at what we build around them. So we're just doing a test and learn on that, and that will all inform how we do our frameworks, how we get strengths-based referrals. So we're pushing at the door to do regional referral forms, regional quality assurance, and also to build in things like forms of cost calculating. So there is a whole bit about profit, but also actually if we're transparent in cost, then that's a big step forward at the moment, because we're not transparent in cost. So one of the things is, if we know our children really well, so we've got our really good needs assessment tool, we know what we're going to purchase, and then we work with the provider about, well, what does that really look like? In an ideal world, in our 2029 vision, we'd really like to be in a position where actually the money was identified by the need of the child and it went with the child. So even if the foster carer didn't quite have all the skills, you had the right resources for that child that could put those skills around them and make that a really stable home. I mean, I was in the Southeast fostering group this morning, and one of the things that really comes out of fostering, which is a real bugbear, is legacy. And what's the real challenge to it is people are trying to provide really stable homes and loving homes for our children and young people. And actually, through legacy processes, they could be penalised for offering stability. So all those things, when we redesigned, because we will go out to tender next year for our new fostering framework, we're going to look at it from a real needs-led way and to really look at a model where we don't incur legacy, and what does that look like, and how can we work that through the system so that it's equitable. So there's some real challenges that we're looking around that. So data is that's fostering as well. Sorry, Luke. Fostering, we're not quite, as you can imagine, not quite in the same space as Manchester. So we have Let's See, which is the fostering hub for the Southeast. And there is a vision that's coming down around redesigning fostering hubs and the connections with the RCCs. So our approach at the moment is we're really working with Lassie, and we will be doing some workshops on that with our local authorities. What does it need to look like? We are a huge area, so one of the things that's really being considered is, do we go for a sub-hub model? What does that look like, and how will it feel? And also the modelling has to look at an end-to-end, which is from initial contact, for interest, right the way through to final approval, with some support, which we're not quite sure which some support means. But that's a very different modelling in what's there at the moment. But I think what's really important about what we're trying to do, and the same with Stephen and that, is to walk alongside and work with our local authorities. And one thing I feel definitely that being in a regional care cooperative, you become a bit of an honest broker because you're not quite the local authority, you're not the provider. So you can have slightly different conversations that maybe you couldn't have had before, to bring people on board and to walk alongside and work together. I'm going to stop there, Stephen, because I know we're running out of time and you want to do questions and stuff, if that's all right.
Yeah.
Sorry, Luke, I'm going to stop. Yeah.
No, that's great. Thank you, Stephen. Thank you, Wendy. There's so much rich information there that will be so useful for everyone who's here watching. So next, we're going to go to Kat and Liz, and they're going to talk through a little bit more about what areas can be doing now to lay the groundwork for a further wave of RCCs. So, Kat, Liz, over to the two of you.
Thanks, Luke and Stephen and Wendy. That's really great to hear about all the progress that's being made in the RCC areas, but we'll zoom back a little bit now. You know, these two areas have both been involved in having an RCC now for like coming up on 2 years. So if you're starting a little bit further at the beginning, and I know a lot of regions are already sort of laying the groundwork for RCCs or have really strong regional work already. So I'm sure a lot of you are coming, from kind of varying stages, but we wanted to talk about some of the things that you can do now to kind of prepare for a potential further wave of RCCs. And for a bit of context, Kat and I were both like coaches from the Mutual Ventures side during the Pathfinder program. So I was involved in supporting Greater Manchester, and Kat was supporting the Southeast through like the setup of the RCC in their respective regions during the Pathfinder program. So I think the first thing is to kind of understand what is the specific regional issues that you want the RCC to solve. So figure out kind of what the situation is in your region now. Do you consistently have the right homes in the right places for children? Are there kind of like specific cohorts of children who are not consistently having their needs met? Are you able to accurately forecast needs and plan in advance based on that? And once you kind of have a sense of where there might be challenges in your region, you can start to think specifically about how that'll inform the development of the RCC and what like activities you're going to do to be able to address those. And it'll also help you when it comes to making a case for investment, because if you can point to the problems, it's easier to kind of prove why there needs to be a change. Secondly, meeting as a group to understand the pros and cons of an RCC. So from this conversation, it's great to figure out what you hope the outcomes might be, but also what some barriers might be. So for example, depending on your region, it's possible if there's a lot of local authority variability and like diversity that some local authorities could benefit more from an RCC than others. So being kind of clear about that from the beginning and being able to understand that and communicate it so that you can start to think about mitigations from the beginning is important. And then finally, well, not finally, but finally, before I turn over to Kat, thinking about leadership and sponsorship arrangements. So both on the operational side, like who is actually going to own the delivery of this and get things going, and then also on the sponsorship side, who is going to be some like key senior stakeholders who will put their weight behind the idea of an RCC and be able to push the idea forward and make sure that it keeps going. Kat will continue here.
Yeah, so thanks, Liz. A couple of other points, largely which are sort of more logistical. So the fourth one around planning where the RCC will be hosted. I think really important just to think about where it makes the most sense. This might be kind of coterminous with where that leadership role ends up being. So I know, for instance, in the Southeast, the RCC was initially hosted by West Sussex County Council, which was where the eventual CEO of the RCC had been working beforehand. So there was a kind of a really good synergy there. Discussing governance arrangements, so thinking about both when you're in the kind of project and setup phase, and then when you go further into the running of the organisation, how will that be governed? So who are the people who will sit on boards? Where will various levels of decisions be made? and kind of figuring out how to make governance work for you rather than be something which hampers decision making and is overly onerous. So that balance of being robust but not hampering what you can and can't do. And then the last one on this list, involving partners early. So the collaboration with health and with youth justice and education is really key to the kind of specificity and the new model of RCCs. On the Southeast, for instance, there was a seconded person who came in from the health service who was really instrumental in figuring out how to kind of work with health, and who kind of had the contacts and knew who to get in touch with to kind of move the collaboration with health forward. And that was really invaluable. So I would encourage you to think about who are those people who are kind of the key people in the region who know who to speak to and who are able to move things forward in terms of partnership working. With all of this being said, the kind of bigger box on the left then really leading to the development of a delivery and accompanying resource plan. So being kind of realistic around the resource that you have available to you, and what that will look like, and the kind of intended outcome measures that is all tracking towards. I think we have time to go to questions now. So look, I'll hand over to you to get through some of these questions.
Great, thank you, Kat. Yeah, so with the last few minutes that we have left, we're going to go to question and answers, and there's quite a lot that have been submitted. So thank you to everyone who's been doing that. We've actually had, I'm just going to go through and pick some out. So Stephen, there's one here for you around Greater Manchester RCC and what has it done, particularly with the sufficiency of foster care. I don't know if there's something that you can pick up on that. I know you talked a little bit about it earlier, but whether you could expand a bit more around what they're doing to help with the recruitment of foster carers.
Yeah, no, that's fine. Yeah, I think like what we've rightly sort of recognised, and we all accept it's a really challenging environment for us, isn't it? Is the truth of it. There is no getting away from that, and that's the same, I think, pretty much wherever you go across the country. So with that said, what incremental changes or what support do we think we can put in place that would help provide the system really to try and ensure that we do have a more buoyant market, or we've got a better and robust, as good as possible offer and robust offer that we can have for our own foster carers. So I've obviously touched a little bit around the sort of fostering hub, certainly already, and how that now kind of sits within the RCC, and just sort of reiterating some of that around some of the green shoots that we have actually seen around some of the conversion rates from inquiry to application. They've increased. So we've got a really great offer actually from some of our foster care ambassadors. The support that they've provided has been really invaluable. We're also hoping to see some higher overall approval figures, expecting in the coming months as well. So again, it's we appreciate and recognise as an end-to-end process and a broader system, it's something that we need to be supporting in the long term, as well as the broader work that we're trying to do from a recruitment perspective. We've got some really great people and great work that's going on to try and help with the kind of fostering recruitment campaign as well. Again, we see that's something, it's not going to be a do it once and these things are kind of solved. We know it needs to be a continual and significant investment really around what we can do there. I've already sort of mentioned some of the specific programs like Room Makers, which is having we're able to evidence a real impact there in terms of the numbers of applications that we've been able to accept and proceed with, that have meant to real changes taking place in people's homes. That means, and those carers already being approved and ready to be able to take more children. So that's another strand for us. Again, we are really mindful, like a lot of people will be, about wanting to make sure that we can engage as effectively as we can do with the IFA sector as well. And we've been doing a lot of work in that space through individual conversations, IFA summits, really positive take up actually as well, not just with from a fostering perspective. I would say probably the same across across the sufficiency sector, but obviously relating specifically to IFAs. We had over 60 attendees when we've held those events, really listening to them about a bit of kind of what Wendy's touched on before. What are some of the points of tension actually for them, and potentially some of the historical arrangements, and how can we try and change some of those going forward, because we know they're telling us they can be a real barriers for some carers and the retention of carers. So unpacking really with them, what can we do and how can we support them, because we do have a role to play in supporting them as organisations and entities to either access some of the opportunities that we know we've been able to evidence, room makers, for example, being one, which they're doing. But what's our role in supporting them and working alongside them to ensure that they can recruit and retain more carers for the region? Berry assessments, CANS assessments, things that Wendy's given examples of. There's lots of things there again that we think actually those can be really helpful around helping to understand and assure carers around the needs of our children, give them a really great understanding, and make sure that we've got the right support for children, helping with both the recruitment, but also helping them and being with them when things can prove to be a little bit tricky. So there's kind of several things that we know that we need to do, and we are doing. GM first, again, there's a lot of things that we would like to do, and we're talking to providers around. How can we ensure we all agree and we're committed to trying to keep children as close to their home, where they call home, as possible, and that will mean hopefully us utilising foster carers that operate within our region. So again, how can we make sure that we're helping to prioritise, and they are some of our children, accessing some of those local carers, as well as being able to describe to them and help support them on that sort of recruitment journey, really, to make sure that we've got as many carers as we actually need, because the reality is, as has probably been alluded to in the questions and some of the areas we'll be mindful of, we certainly don't have enough foster carers in Greater Manchester, in any of the individual LAs, nor GM as a whole. That's been a real issue for us for a number of years and continues to be, and is rightly therefore one of our biggest priorities, really, to try and help address.
Yeah, thank you, Stephen. And I know there was a lot of questions that were submitted, and quite a lot. We've managed to get to a lot of them in the Q&A box itself, so you should have a written answer for those. For the others that we haven't yet got to, we will do our best to probably follow up with after the webinar due to time now. But thank you everyone for attending. Just wanted to highlight that if you have any kind of burning questions and you would like to reach out to any of us, please do. Our email addresses are on the screen, so take a note of those where you can. And just wanted to add as well that for the journey of the two pathfinders in their journey to establish their RCCs, there's a lot of information that currently sits on the Mutual Ventures website, including our report, which shares insights into the journey to establish the two pathfinder RCCs. And for more information on any of this, or more information or informal discussion on what this could mean for your region, please do reach out to any of us. We'd love to talk. We'd love to hear what's happening and see where we can support. But thanks again, everyone, for attending. We look forward to seeing you all with something like this again soon.